Hello everybody, today I wanted to talk about multiple sclerosis. Multiple sclerosis is the debilitating disease of the brain and the spinal cord. In MS, the immune system attacks the milling of the nerve layer that can cause the communication problem between your brain and the rest of your body. Eventually, the disease can cause deteriorations and permanent damage of nerve fibers. Signs and symptoms in MS vary between patient to patient, the severity and the location of the disease. Eventually, there is no cure for the MS, but the treatment can help the attack recovery, manage the symptoms, and also modifying the cause. As I told you, that MS sign and symptom different between patient, location, severity of nerve fibers. Most of the sign and symptom are numbness and weakness one part of the body, tingling, slurred speech, loss of balance and coordinations, blurry vision, vision loss with painful eye movement or double vision, fatigue, cognitive disorder, mood swings, and bowel, bladders, and sexual disorders. The course of the disease is different. Most of the patients suffering from relapsing remitting course. In relapsing remitting course, the new symptom of neurologic coming to the patient or relapsing over a days, then with partially or complete recoveries followed by the remission period for months or even for years. But in 20 to 40% of the relapsing remitting patients, there is no relapsing after a time, and a steady progression time happen, which is called secondary progressive MS. And in some of them, there is no attack happen, just gradually onset of the symptoms, progression during the time, which is called primary progressive MS. In MS, the cause is unknown, but there are some risk factors such as age. Between 20 to 14 years old, usually the MS happen. Also, in other ages, older or younger, also can happen, but most prominent between 20 to 14 years old. Sex in women 2 to 3 times more than men. Family history of the MS in siblings and parents increase the risk of the MS. Viral infections. Nowadays they understand the incidence of MS correlation with Epstein-Barr virus. Vitamin D deficiency. Low vitamin D deficiency and lack of sun exposure correlation with the risk of the MS. Climate. North of America, Canada, South of Australia, and New Zealand are the parts of the world that's most prone to have MS. Smoking. If the patients with a sign of the neurologic smoker compared to non-smoker patients, the risk of the relapsing is more. So what are the complications of the MS? MS complications are muscle spasm or stiffness, cognitive disorder, finding word difficulty or forgetfulness, disturbing of the bowels and bladders and sexual disorders, and mood problems such as anxiety, depression, mood swings, and weakness of or paralyzing part of the body, typically in lower limbs, and in rare cases, seizure. So please feel free to contact us in RAC Hospital about multiple sclerosis.